Well, good afternoon, everyone. Thank you for joining our webinar on youth, young adult, and parent engagement. This is Peggy McManus from Got Transition. I want to let you know that today is the last of 5 webinars that Got Transition has held looking at care coordination and healthcare transition. I think this has been a very exciting opportunity for us to share innovative efforts underway in Title V supported care coordination programs and also to share our Got Transition resources. I'm excited to let you know that for each of our webinars, we've had more than 100 attendees representing more than 30 states on each call and several health plans as well. So today, I'm very pleased to introduce our panel of experts. We have with us Mallory Surr, Becky Burns, and Maya Stitt. Hold on one second. Mallory Surr, which many of you might be familiar with, Mal has had an impressive track record as a youth and young adult advocacy leader on healthcare transition, starting with her work with a previous Healthy and Ready to Work National Center on Healthcare Transition, and serving as a youth coordinator for the state of Maine's Children with Special Healthcare Needs program. Since 2013, Mallory has served as a consultant to Got Transition and also for the National Youth Organization Kids as Self-Advocates, or CASA, as many of you may know. Mal has also served on advisory committees for Youth Move National, the Catalyst Center, the National Genetics Alliance, and the Association of Maternal and Child Health Programs, and has provided keynote presentations and technical assistance on topics of transition to adulthood, meaningful youth engagement, and self-determination for young people with special health needs and disability. Also joining us today from the state of Wisconsin is Maya Stitt. She is the Youth Health Transition Initiative Coordinator at the Wiseman Center in Wisconsin. In that capacity, Maya supports youth, families, and health professionals in Wisconsin as they navigate the transition from pediatric to adult care. Maya has been involved in advancing and improving the rights, awareness, and services available during transitions toward independent healthcare management, and she serves as a member of Wisconsin's Health Watch Leadership Council and the Community Advisory Team for the Providers and Teens Communicating for Health, otherwise known as PATCH. And also with us today, we're pleased to welcome Becky Burns, who is the statewide coordinator of the Children and Youth with Special Healthcare Needs program. Becky's career centers on supporting children and families whose lives have been affected by unanticipated journeys through the world of disability services. She treasures the opportunities to work with these families whose resilience and growth continues to astound her. With a Master's of Science in Social Work, Becky has used her education along with her personal experience of being raised in a family with a child who has a disability to influence her work. So I'm very excited and pleased to be with all of you today. So if we could advance the slides. Next slide. Hold on, a little glitch here. We're going to get it straightened in a second. Apologies here. Just while we're waiting for this slide, I'm going to just summarize to you what our webinar goals have been for this series. The first is to support state Title V implementation and measurement of healthcare transition in care coordination programs, and to guide these care coordination improvements by sequentially building on the 6 core elements of healthcare transition, as well as to share promising practices from state Title V care coordination programs. So today, at the conclusion of this webinar, we hope that you will all walk away with a greater understanding of the youth, young adult, and parent engagement levels. One more flip, yeah. Of the youth, young adult, and parent engagement levels in the 6 core elements, that you will be able to identify parent and family and youth engagement frameworks or models. You'll be able to discuss opportunities and principles for involving and providing support to youth, young adults, and parents, and become familiar with some of our resources and learn about exciting efforts underway in Wisconsin. Next slide, please. So today, as with all of our other webinar series, we have a set of handouts that are available on our website. So there's Family Voices issue brief on family engagement, as well as Eileen Ferlenz's Progression of Leadership. And then we've got some resources from Gut Transition, as well as Wisconsin's resources. So now I'm just going to do a very brief recap for you of our last 4 sessions. The last one, which was led by Patience White and Indiana's Mary Ciccarelli, reviewed the development of an adult healthcare policy with welcome and FAQs. And we spent quite a bit of time talking about what Indiana's Center for Youth and Adults with Conditions of Childhood do to support young adults to prepare and be ready for adult-centered care. Next slide. For webinar 3 on transfer to adult care, we featured Karen Rundell and Lee Gordon from Kentucky and Kathy Rivers from Maryland's Coordinating Center. And we discussed ways to identify adult providers. We discussed an adult model of care. We reviewed the contents of a transfer package, discussed ways to support adult practices, and learned about Kentucky and Maryland's exciting efforts. Recapping webinar 2, which was led by Patience White and Michelle Jiggets from DC's Children's National Medical Center, we reviewed the fundamentals of the 6 core elements, in particular the policy, tracking, readiness, and planning. And then we previewed some of the customized tools that were prepared by the American College of Physicians and learned about DC's Parent Navigator program that has customized the core elements. And finally, with the first webinar, we laid out the clinical foundations and the performance measurement options in the core elements. We discussed the results from our Title V Care Coordination Survey, and we got to the point of writing an aim statement for an initial healthcare transition pilot. So let's begin here. So right now I'm going to talk about the youth and family engagement level. So at the very outset of our work a year ago, we did a survey of state Title V agencies looking at how they are doing with implementing the core elements in their care coordination programs. And there were 7 domains that we looked at, one of which was youth and family engagement. And in this way, the care coordinators could rank whether they were at level 1, 2, 3, or 4, with level 1 being the basic level. In this case, the care coordination program offers general information about healthcare transition to youth with special needs and parent, but has limited involvement of them in their healthcare transition program development and evaluation. And then you keep going higher up the scale and you look at level 4 and you see that care coordination program offers healthcare education to youth with special needs and parents and involves them as leaders in healthcare transition, knowledgeable about the 6 core elements, and involved in statewide efforts to advance healthcare transition improvements. So let's look at where we were. So in 2017, we heard from 28 of the 32 states that selected transition performance. And on this domain, youth and family engagement, the average score was 1.6. So we had 26 states scoring at the lower levels of 1 and 2, or 2, and 2 states, Kentucky and Indiana, scoring at levels 3 and 4. So next slide, please. I think hopefully our aim today here is that we want to encourage state Title V supported care coordination programs to consider adding a new strategy or aim going forward. For example, to increase the level of youth and family engagement in healthcare transition from the state's baseline level, which is for the most part level 1 or 2, to a level 3 or 4 in their care coordination programs. So I hope, as you will hear from Mallory and the Wisconsin leaders, you'll get some great ideas about how to move from levels 1 or 2 up to level 3 or 4. So I'm going to happily turn it over to Mal. And we're not hearing Mal. I know I spoke with her earlier in the day and she had a...
Oh, hi. Hello.
Oh, there you go.
Hi. Sorry, I was muted in multiple places. Thanks, everyone, for joining us. I'm so excited to discuss this topic with you. It's something that I'm very passionate about and have worked closely with Got Transition for many years. So I hope that you can take away some key lessons from this and work to improve all of your organizations and agencies. Next slide. So first, I wanted to share just a few key things that I have seen in many states and talk about what does it really take to establish authentic and meaningful youth engagement. We all hear about it. We all hear about having youth voice at the table, but what does that really look like? The first one is time. The hard part about fully engaging youth is that youth have very different schedules. Sometimes we have to have meetings in the evening. We have to have different communication styles, contact them, at different hours of the day. Support and training is a really big one, and we'll talk more about that and some strategies and ways to think about that. But if we're not setting up young people for success to be engaged, they're not going to feel engaged, and which makes us think they don't want to be engaged, and so it's kind of a vicious cycle. Patience is a big one. When we work with any individuals that have different types of personalities in the workplace, different beliefs, different communication abilities, it requires patience. Working with youth requires an even deeper level of patience because they may not have had these experiences or those levels of being professional before. So it really, when you jump into the youth engagement pond, you really have to be ready to take it on fully. Flexibility. In addition to working different times and being willing to kind of train them as they're helping you, flexibility is one of the biggest components. And in order to maintain and sustain the youth engagement models that we're going to be talking about, you really need to be willing to find different ways or ask what their preference is for being engaged, whether that's texting or email, and think about what is going to work for them. And then that may inquire a discussion about what are we going to do to really make sure we're getting your feedback in a meaningful way. When we start talking about disabilities and individuals with chronic health conditions, that may even require a different type of communication. So one of the biggest ones that I think people run into, and from what I've seen, is youth and family engagement costs money. In order to maintain and sustain, the models that we're going to talk about, young people need to be compensated for their time as you would any subject matter expert or consultant. If they're participating in a consultant role, they need to be honored for that. Youth and families are asked to tell their stories over and over and over again, and eventually they may not feel valued if they're not being compensated in different ways. And lived experience, living with a disability, sharing your personal experience, talking about your health needs, very private information, that counts as a skill that youth and families are contributing to the work. And finally, to sustain your programs, these advisories, and the models we're going to talk about, there needs to be buy-in from all levels. So this may include adding money to your annual budget and having a solid plan to make sure that these folks are involved as equal partners. Next slide. So now we're going to talk about a couple of different frameworks for youth and family engagement. And one of the first ones that I want to share, and one that I tend to refer to the most, was created by one of my dear friends and greatest mentors, Eileen Ferlenza. Many of you may know of her work. She's been very involved in maternal child health, Title V, and got transition for many years. And so this is called the progression of leadership. And if you can't tell from the slide, the inner ring there says family, the middle ring says community, and the outer ring is others. So to go over what these kind of refer to, the inner ring is working with the family, individual advocacy, being able to advocate for yourself. So a youth who's in the inner ring may be able to speak up for themselves in school about what they need, but they're not yet advocating for others. So in a healthcare transition context, this may mean working with the family to develop their service plan, or working with that family one-on-one to make them feel self-empowered. The second ring is the community ring. And so what that may mean for youth is helping people that you know advocate for themselves, or kind of supporting each other, joining a local group or a local advocacy group, but kind of staying within that really close community. In terms of healthcare transition, that could mean working with family leaders to develop training that will be used to engage other families, and including families in developing feedback mechanisms, ways to give their input. The outer ring is what we're talking about when we talk about really big scale input, being involved in the national advisories, lobbying for policy change, either nationally or within your state, putting them in a place that is true leadership where they are the spokesperson. And so the importance of setting up, youth and families for success really can be symbolized within this ring. And if they're not set up for success, they don't feel comfortable advocating in outer ring situations if they only have an inner ring skill set. So what we need to really be aware of is when we're bringing these youth and families to the table, are they inner ring youth or are they outer ring youth? What level of experience do they have? And how can we prepare them to go from one to the next without putting an inner ring youth in an outer ring situation? Next slide. So the next framework we're going to talk about is one that was written about by Family Voices and with the Lucille Paxson Foundation, the framework for assessing family engagement in systems change. And that's one of your handouts that has been provided. So the four components of this are representation, transparency, impact, and commitment. Representation, I know, is a tough one. It can depend a lot on where you're located, on what type of services you deliver, but it's the importance of making sure that whatever group you're pulling together has diversity in terms of geography, in terms of ethnicity, culture, education, and also to think about what lived experience they may be bringing to the table. For the Got Transition Youth Advisory, which I'll talk more about towards the end, we made sure we reached out to existing youth advocacy organizations across the country. We wanted a diverse group of disabilities, youth who had a wide variety of experiences and skills to bring to the table. And we worked really hard to make sure that that was what we were getting. And I'll talk more about what process we used for recruiting. But we really wanted to make sure that it wasn't the same 5 people giving their input at every meeting and every product. And I think sometimes we get comfortable in the same people coming to the table because they're willing, they're eager, they're comfortable sharing, but we're only hearing such a small percentage of what could potentially be changed or be created. Transparency. So when I think about transparency in terms of youth engagement, what I really think about is honest communication. And this means being really transparent and honest with, is this project time limited? Or were there changes in the course of the project? Are resources and funding for this project limited? A lot of what I've seen is that a really great youth engagement effort is connected to a grant or some type of limited funding, but there's no conversation, there's no honesty about that in the beginning. And so the young people come together, they share their very personal story. Many times they really build friendship and connections, and this is what they look forward to outside of school or activities. This is their community. But then when the project ends, there's also no closing conversation. And so the youth just sort of feel dropped, or, we decided we didn't want to go in that direction. And so it's sort of like, having a group of friends or having a job, and all of a sudden it just goes away. And so really making sure that whatever conversations are happening within your organization, that youth and families are being informed of that as well. Impact. Youth want to know how their input is being used, whether that's coming together at a meeting and sharing what happened at a higher level that was influenced by their work, quoting them on your website in materials, just showing them different ways that their ideas or their personal experience is being used. Youth and families share their stories over and over, hoping for change to be made. And after a long time of not seeing that change, they may potentially stop being willing to share their story. Sometimes they feel used and that their voice doesn't matter. Even if somebody's personal story has impacted you on a personal level or changed the way you do their work, tell them. Even just giving them that validation that it made a difference to be at the table. Those small things can create that resiliency of wanting to be engaged. The final component of this framework is commitment. Youth engagement must be at the center of your work. It must have all people on board. It must be included in the budget, and there must be real ways for them to contribute. It's not enough to invite youth and young adults to a meeting if they don't have the context, if they don't know what their role is. They need to be honored as equal partners. And there needs to be money, as I mentioned previously, to support that real involvement, and there needs to be a plan of what their role is and how they can contribute before they get to the table. Next slide. This framework I'm just going to go over really quickly because it's very kind of more complex, but it's got some great context. This is also included in one of your handouts, the ladder of participation. And so really this talks about different levels that youth can be engaged. And what I have seen in my experience is that most organizations tend to get stuck around level 3, the tokenism. We have the youth at the table, but we aren't totally sure where to go from there. And our goal is to see within healthcare transition, youth and young adults kind of at level 3 and 4 with organizations engaging them. Next slide. And before I jump into this other handout, I want to jump back to talk about one other thing about youth and young adults feeling engaged. One thing I've noticed talking about the validation is providing them either a title or even business cards that give them a role within your organization. One of the worst things I hear is when young people or family members are at the table and everyone introduces themselves as doctors or consultants, and then the person says, "I'm just a mom." And that breaks my heart because we know that family members give some of the most valuable input into these programs, into these models. And for someone to discredit themselves by saying just a mom or just a youth, I don't really know why I'm here. We shouldn't be seeing that anymore. So whatever ways that we can think of to validate their identities at the table, I honor you to consider. So the last framework we want to talk about is the School-Based Health Alliance Youth and Engagement Toolkit. And they discuss 3 different participation models. Being youth-led, where the youth or young adult is really the main spokesperson, but looks to adults to provide the administration support and run the program and do the behind-the-scenes kind of thing. Youth-adult partnership. The youth, the young adult, or the adults are equal partnerships in developing a common agenda and seeing it through. or adult-led, where adults seek out youth and young adults as core constituents. And all of these are great models and ways to engage youth, but what I ask of you is when you're implementing any one of these, to be honest and transparent about which one you're using and the role of that young person. Next slide. So the 6 core elements we have been talking about for a long time. It's the foundation of GOT transition. They're included in your handouts. They're included on our website. And really, we can give entire presentations on this and how each element can have genuine youth and family engagement. But really, it's about involving youth and families in the process, in all of these components, moving at their pace and making sure they feel comfortable with the plan and assessing their readiness to move forward with the process. All of these tools and resources are available on gottransition.org and can be downloaded and customized for your agency's use. We would love to hear any input on how you use these tools and how you've seen family and youth engagement play a part. I always say that, the biggest part where family and youth kind of are at the table is the readiness and the planning, making sure that everybody knows what is to come and where that youth and family is at, and really meeting them at where they're at, not feeling pressured or not pushing them to maybe take a step that they're not ready to if there are additional supports they can access or conversations they can have. Next slide. So one of our biggest achievements within this GOT transition iteration has been the National Young Adult Advisory Group, and I am so excited to see something like this come into play. I have said for so many years, there has to be other people who can do this work. I always joke with Peg and Patience, I love that you think I'm forever young, but we need to be having people who can carry this torch when I eventually go and do things in the adult world, which I've seen is not very fun, but it must be done. And so our group is consisted of 12 young adults with and without disabilities, ranging from 18 to 25 years old, and they represent various national and state health-related organizations. We have quarterly calls with them to help assist in our messaging and how we can improve transition to adult care and accessing care and coverage. And to give a little insight into what this process looked like, we created an application and we asked for each organization to send us some recommend some individuals to submit an application. And then we divided and conquered and interviewed all of these individuals, decided who we wanted to select based on their experience and their diversity. And then we asked them if they would be willing to participate. And it was a tough process, but very, very worthwhile because we got a great selection of young people. So it's been really exciting to see the development of that. They also helped us create the healthcare transition quiz, which I'll get to, and a social media toolkit. Next slide. Some of the young adult messages that we created, I'll buzz through really quick. Why my health? I have continued to say over the years, youth need a reason to do things. Any of us need a reason to do things. Why do any of us go to work every day for a paycheck? Maybe we like it while we're there, but ultimately we need money to pay the bills and we need a job to get a paycheck. Youth need a reason to understand why they need to go to the doctor. Why should I be healthy? Is it for my relationships? Is it so I can go to work? Is it so I can hang out with my friends? If it's to sit home and play video games all day, maybe that's not enough of a justification for me to want to take care of my health. It's a big process. So start asking youth, why do you want to be healthy? What's in it for me? Again, thinking about what is in it for me. At the end of the day, why do I want to do these things? And this is something I've seen in multiple presentations in business, in healthcare, YIFM. It's, why do we do anything? What is the incentive? Take charge of your life, take charge of your health. Being empowered, feeling empowered, even if it can be a little bit overwhelming, and taking those small stepping stones to start talking about transition in tangible ways. And changing roles. One of our, our readiness assessments began as changing roles, looking at what does the family do? What can the youth do? What are those small steps? Carrying your own insurance card, in ordering your own prescriptions on your iPhone app, updating your health information on your cell phone. All of these are really small steps that can lead to a young person feeling empowered to take on their own health. Next slide. So the Young Adult Quiz is something that was created with the help of the Young Adult Advisory. And, for those of you who spend any time on the internet probably know about BuzzFeed. And thinking about how young people and most of our society processes information now, it's very quick. It's very, what can we do to grab the attention of young people in, 5 minutes or less? And so they created this great quiz, which you can take on our website, and to figure out, how ready are you to transition? And we had our young adult representatives test this out on their friends. And they came back and said, hey, they really wish they would have asked about this. They didn't know about health insurance, but it gave some really great resources. So I encourage you to try that. Take the quiz within your agency, see where you are. Take it with your youth leaders, spread the word, and let's get people talking about healthcare transition in a cool way. Next slide. And the final thing I'm going to talk about is our social media toolkit. Many organizations and agencies do their own marketing, or they want to communicate about transition, but they don't really know how to start the conversation. So we've created some sample Facebook posts, tweets, things to put in your newsletter, some memes, some graphics, some really quick things that you can just grab and say, hey, we want to talk about transition. Do you know about that transition? Where are you in your transition process? Some really cool things that you can use, tangible ways to start the conversation. Next slide. And so with that, I want to thank everybody. My contact information is at the end of the presentation. I look forward to hearing any questions you may have. And with that, I will turn it over to my great partners from Wisconsin.
Thanks so much, Mal. We look forward now to hearing from Becky Burns and Maya Stitt from Wisconsin.
Next slide, please. So I'm going to just spend a moment providing some background context for the Wisconsin Children and Youth with Special Healthcare Needs program before turning it over to Maya for the remainder of the presentation. The Wisconsin Title V CYSHCN program, unlike some other states, does not provide or pay for direct clinical services or care coordination services. Instead, we contract with several entities to support CYSHCN systems improvement efforts. Our network, starting at the bottom left of the circle, includes ABC for Health, a nonprofit law firm that supports accessing and maximizing insurance and public benefits. They provide training and TA to our network families and providers. Next is the Wisconsin Medical Home Initiative, located at the Children's Health Alliance of Wisconsin at the Children's Hospital of Wisconsin, is our lead for medical home outreach and implementation, including administration of our QI grants with health practices and systems. Parent to Parent of Wisconsin provides one-on-one parent matching. Family Voices of Wisconsin is our lead for advocacy and family engagement and leadership activities. We have 5 regional centers that provide information, make referrals and follow-ups to link youth and families to resources. They provide outreach training related to medical home and youth health transition and support family engagement and leadership efforts in partnership with Family Voices of Wisconsin and as part of our QI efforts with healthcare systems and practices. And finally, our Youth Health Transition Initiative. The CYSHCN program contracts with the University of Wisconsin's Weissman Center, which is also a home to our LEN program in USED, to house our Youth Health Transition Initiative. We utilize the 6 core elements to frame components of our youth health transition efforts, like our transition trainings and QI grants that you'll hear more about from Maya. Next slide, please. At our website, healthtransitionwi.org, you will find tools and resources from our national partners like Got Transition, but also tools and resources developed by Wisconsin, such as the Pocket Guide for Youth or recordings from our learning community calls. Next slide, please. The goals of our Youth Health Transition Hub are to encourage Wisconsin's youth and their families to make individual choices to enhance their health and well-being, to provide Wisconsin and national health transition tools and resources, and to offer our Build Your Bridge training to families. Next slide, please. We partner with healthcare systems, providers, and the community to share health transition tools and resources statewide. We support practices and healthcare systems to initiate processes to increase awareness and skills that encourage successful healthcare transition. Next slide, please. And we provide youth with special healthcare needs and their families with connections to our network of Wisconsin collaborators. Now I'll turn it over to Maya to share more details.
Great. Next, we're going to stay on this slide, actually. Thanks, Becky. So along with the individual goals that we have for each group that Becky discussed, there's also an overarching goal of family engagement. And this begins with our team leading by example, prioritizing family engagement, and then encouraging it where that's possible. First, we must ensure that we have leadership support. And that includes our leadership from health systems, and that of our community partners. Next, it's working to inform, educate, and build awareness with families. Many health systems are adopting a whole-centered, patient-centered approach, whole person, patient-centered approach to healthcare, and ensuring that families are part of this is crucial. And then finally, ensuring that we have relationships with our local community partners. They're not only working with families in the local community, but typically live in that community and take part in community programs, the schools, and events. Next slide, please. Using an ABC's approach to our outreach, we A, align with the 6 core elements from GOT Transition, B, branding to ensure that we have the same look and feel for recognition, quality, and consistency, and C, common messaging. We have a large network promoting all of our efforts, and this ensures that we're saying all the same thing. Next slide, please. I'm going to provide 2 examples of where our approach towards family engagement has had success. So first, we have our quality improvement grants. Wisconsin offers annual grants to healthcare systems who are interested in advancing their healthcare efforts, healthcare transition efforts, and this is system-wide or clinic-specific. Interested teams are required to describe how they will ensure family engagement throughout the grant cycle, and it encourages the health system to think critically about healthcare transition in partnership with families and youth. The second part, the example that I'm going to use is also something called our curriculum development process, where we provide knowledge and skill building across multiple audiences using a presentation, handouts, and a hands-on learning style. Next slide, please. So first, looking at our QI grants, family engagement is prioritized, as I said at the beginning, in that initial application. We ask for the group to detail how they are going to go about including families and youth as partners in their QI work. We also increase that accountability by requesting the name of a youth and a family member who will be dedicated team members. The grants have been a place of QI for our team as well. We've received feedback from past grantees that require more direction on what we mean by family engagement, or how do I go about engaging families. And this is where our partnerships with family leadership teams and engagement groups were helpful. Places like Family Voices of Wisconsin and the Center for Patient Partnerships offered guidance on what true family engagement looks like and the models with categories and definitions. And this is still new territory for us as grant administrators and for the QI teams. So we've been working things out as we go and not waiting for perfection to take action. But really the best way forward is to get started. Next slide, please. This slide shows the patient engagement categories that I spoke of from the CPP. It's a framework that we continue to use to build our knowledge on family engagement and try to inform others who are doing similar work. Notice this is a continuum concept and not levels, and all the categories are valuable approaches towards inclusion. You have a link provided in the handouts. Next slide, please. I like this because it's a photo of Sharon at our 2017 Grantee Summit, where she is a leader discussing ideas for advancing family engagement with our grantees and demonstrating that we take family engagement as a priority. Next slide. The second example I mentioned is our curriculum development. We have hubs of expertise that provide the core framework for curriculum, and we also then started with a focus on a training for parents of transition-aged youth. We asked for input from quality improvement grantees, regional centers, and family voices of Wisconsin, and they all helped us pull together family perspectives into the curriculum development process, as well as ensuring family and youth participation in the development teams. Next slide, please. Using that core framework allowed for rapid replication. The more time that we could then focus on a family engagement process. Listed here are the 3 training options that we offer currently, as well as the intended audience. Next slide, please. Here is a list of key stakeholders who participated in our work groups and offered a variety of perspectives. It was the role of the coordinator to ensure that all parties, especially youth and family members, felt comfortable providing input. For example, offering time for smaller group discussions or one-on-one environments was sometimes a better opportunity for those to express their opinions or perspectives. Next slide, please. During the pilot phase, it was also important to ensure that we received feedback as neutrally as possible. I also felt like this was a chance for us to speak towards the credibility of our approach towards family engagement. By actually incorporating the feedback and making changes on what we heard from families and youth, we weren't just checking the box, but actively listening and engaging with families and youth and respecting their perspectives. Next slide, please. Finally, it's important to know if we're doing what we intended to do. The main question, is it working? We used 2 types of evaluations, a standard evaluative type that was on learning and enjoyment and the standard evaluation questions, but there was also a second one on content and format, which is what we used for revisions. It was in these pilots that we very clearly heard from youth that this was parent-focused and not a youth-focused presentation. Next slide, please. This is just a slide with a couple pictures of multiple audiences. The core elements of our presentation remain the same. However, we modify the information presented depending on the audience. Next slide, please. Our outreach approach was developed through rapid cycle quality improvement. We started with a survey of the landscape, gathered information from other efforts in states here in the US, as well as other countries, and attended the AmChip 2017, where we heard experiences from other states at the youth engagement breakout sessions. We really appreciated those, thank you. We also received support from our 5 regional centers throughout Wisconsin, as well as grantees, state partners, and local grassroots organizations. Many of these groups are already out in our local communities, and they're aware of what the families and resources are in that area. We also had an opportunity to connect and build relationships with state programs, local health systems, at conferences and presentations. These relationships took time to build, but our patience and persistence paid off. And they have been valuable as we continue forward. We're already at the slide I need you to be on, so I'm going to have you stay right here. This is where the alignment with other organizations was helpful. We could meet with youth, families, and professionals where they were at, and not just in physical location, but also where they were in knowledge and skills. Since we were going to be presenting core elements of transition into their daily work, understanding their systems expectations, their workflows, and as well as the challenges that they were facing, allowed us to put our tools and resources and input from family and youth into their systems and show how we could help with those challenges. So, this included partnerships with youth engagement groups such as Patch, as well as state adolescent health and mental and behavioral health programs, professional associations, as well as school-based efforts. And here I just want to highlight that, after all, educators and school nurses are in frequent contact with youth. With the new federal mandates requiring that children have a post-secondary transition plan at age 14, aligning our messages and tools to fit inside those questions with the P2P encourages and empowers educators and nurses to be an active participant in conversations like IEPs, and also ensures that transition is part of that discussion. Next slide, please. So, all this about families, parents, health systems, but what about the youth voice? After all, they are the ones who are transitioning. Next slide. A good example of our efforts towards youth engagement was our most recent Learning Community webinar. This was an opportunity to hear directly from a youth advocate, as well as an organization that not only listens to youth, but partners with them and actually employs them. The recording of this session is listed on the slides in our handouts. Next slide, please. So some of the unique considerations we've found that we've needed to be sensitive to when working with youth and families too. There's quite a list there. I'm not going to go through all of them individually, but I do want to point out the first one. Oftentimes, these efforts that we do are part of a job, an initiative, or a requirement of a system. Typically, there is a personal connection that drives our passion, but for self-care and sanity, we've learned strategies to leave this at the office. However, for teens and parents, this can be nothing but personal. It is about them, they've lived it, there's no off button. So we need to be sensitive to this, and it's crucial for additional relationships and for trust building. Next slide, please. This slide probably looks familiar to many who are on the call who are maybe doing similar work in engagement. There are often a variety of audiences with different ways of communicating, whether they're cultural or within system requirements and workflows, and that can change the messaging and the strategies. Also, knowing when to engage and what's most appropriate. There are always time and money constraints, and priority and availability among key stakeholders and transition champions can vary. And then finally, being patient but persistent is often a challenge in the fast-paced environments in which we live and work. Next slide. But I'm going to end on our successes. So we've built some great partnerships. We found innovative and creative ways to engage, offer incentives, and support. But main thing we found is something that Mallory mentioned, which is transparency. We're professional, we're prepared for our interactions, and we have a general idea of where we want to go. But we're also honest about areas where we could get by with a little help from our friends. Next slide. And finally, for our vision for family engagement in the future here in Wisconsin, we want to increase replication and reach using the methods that I've listed here to partner with more families in Wisconsin. We want to continue our efforts in youth engagement through partnerships and not lose sight of our main goal, which is achieving positive outcomes for adolescent healthcare transition. Thank you.
Thank you so very much, Mal, Becky, and Maya. I think we saw the circle come together, looking at the variety of ways of how youth engagement is very distinct, but there are some common elements with family engagement, and also to learn how one state has really taken this up with great commitment. I also want to thank Sharon Fleschfresser, who unfortunately we tried diligently to get a phone connection. She is not in her nearby office, but she has been very much actively involved in this webinar. So I want to open it up now for questions for Mal and Becky and Maya. Let me throw out a first question. I'm wondering if you could make some suggestions, as you have done, Maya, about where to identify youth and young adults that might be interested in participating as partners, whether it's on QI or education or whatever. I'm wondering where Title V agencies or others might look to find youth and young adults.
Sure. So I think it just depends on the avenue in which you're trying to reach those adolescents. So typically when we're working with our QI grantees, there's a person on the team who knows they see someone in clinic who's just, they have in mind when they think about engagement. They're on top already of their healthcare information and they're willing to contribute information or are very opinionated and want to be part of that. So that's, I think, where they come from when we're doing those kind of recommendations come from in clinics. When I've been out networking in the community and at presentations, you just get a feel for people who are just excited about being there, especially in a presentation. You can get that eye contact and somebody who's just really excited. Or you get a parent who's maybe, you know, wanting to get their kid involved, and so they talk about them and they're like, thanks, mom, you know, that, okay, you can stop talking to her about me now. But then following up with that individual and saying, you know, your mom says you're interested, but really what would you be willing to do? Like, what's comfortable for you? So those are just two options that I've used both within our clinic-specific quality improvement work, as well as just outreach in general in conferences and even booth settings.
That's great. And Mal, I'm wondering also if you could comment about with the young adult advisory group, just mentioning some of the organizations that were tapped to participate, because they may suggest ideas for other states in terms of where to look.
Sure. Wow, I didn't know I was going to be quizzed. No, I'm just kidding. So I can remember a few off the top of my head. I know we have somebody from the ARC, I believe, Special Olympics, Youth Move National, which focuses on young people who have been involved in the mental health and juvenile justice system, Foster Club, so young people who are in foster care, different specialized disease-specific or disability-specific organizations, national advocacy organizations, trying to think of some other ones. NAMI is another mental health one. I'm not sure if they have youth things, but other organizations that have that reach.
That's great. Also, we peer health educators in colleges might be another option. We have a question here. If an organization is unable to provide financial compensation for youth, young adults, and family, what other compensation would be valuable?
Sure. So I've seen, trying to think, because a lot of them are financially tied. Thinking about gift cards. Sometimes it's just enough to reimburse for mileage, or if you're able to treat them to lunch. A lot of times agencies will have kind of a strategic planning session, and the individuals may not get a stipend, but they're providing meals throughout the day. And so that's kind of a nice treat to just be able to have kind of a working lunch. Certificates are always great, being willing to be a reference for that young person. I see a lot of certificates or a plaque sometimes. There are a lot of different ways, and sometimes even asking the group or the individuals, you know, what would be valuable to you, because people find value in different things. So sometimes for people with disabilities, they're unable to accept stipends over a certain amount, or it may impact their benefits. So they may do gift cards, or they actually offer to donate to a charity of that individual's choice. So a lot of those are financial, but it may be a lesser amount than what a stipend might be considered fair. So those are some ideas, but definitely thinking outside the box, and be willing to ask your group, you know, how do you feel? What makes you feel valued? How can we honor your time and participation? And just showing them that you're willing to honor their time and participation is a big part of it. So I appreciate that question.
Great. Another question came in. Do you have any training for parents of medically complex youth who can't speak up for themselves. I'm wondering if the Wisconsin people have put anything together on that front.
Sure. So I can speak for that a little bit. We are, as I said, in development process of our curricula. When we initially did the Build Your Bridge, which is the curriculum we're referring to, there was a general adolescent health focus just to ensure that we were meeting those national performance measures of with and without special health care needs. However, we also identified right away that many of our QI grantees work inside of medically complex systems and in medically complex clinics, as well as intellectual and developmental disabilities, cognitive disabilities as well. So we do have some training. It does not go into deeply diving into the rabbit hole that is unfortunately the complex need navigation of healthcare systems. But we do offer more supportive ways of running those trainings when we know that we have parents who are coming with medically complex children that may even be unable to verbalize some of their healthcare needs. And we work through different strategies for those parents based off of our expertise and the expertise of our surrounding network partners.
Thank you. I've got another question from my colleague in crime here.
Yeah, this is Patience. I found that it's wonderful working with youth and parents, but often you identify one of each, you know, a youth and a parent who are engaged, but then all of a sudden life happens. So I didn't know whether there's a general suggestion that perhaps having, you know, 2 of each or 3 of each so that they can back up and support themselves and not feel at the table that they're speaking for all youth and all parents. So I wonder if there's any sort of general approach that you guys recommend. Whether
so is that directed at Wisconsin?
Could be. Go ahead, Wisconsin.
Okay, we will. So it typically depends on, again, the group that we're working with. So with our quality improvement grants, yes, we do ask that they identify 1 youth and 1 family member at least. But we do also know, and most of the time the group that they're working with, that individual that they're asking to join, they know their availability. They also are saying, what could you commit to? And then we work with them to think about other ways that they could involve others should that individual not be available. We've also been working with them on remote ideas. So technically having them participate, but not necessarily need to drive to the event or be there in person. We have a lot of very tech-savvy youth out there who are willing to join us remotely. So it's an opportunity to increase that participation without having to have everyone present. And then we do acknowledge that time and priorities change. You know, if you can't play in the basketball game, if you don't show up to practice, that's a priority versus giving feedback and opinions on a team. So it does, though, require a little level of pre-planning and extra planning on the part of participation from youth. One of the non-financial ways that we've been able to also encourage that, especially with our patch group, has been offering transportation, just being able to get them there, not necessarily in the form of a gas card or in money, but rather in the form of just a ride to the event and a ride home. And even things as simple as, well, not simple, but childcare was one of the things that we used with one of our grantee groups. It meant that a lot more families were able to show up, and actually some of the youth even too, because it meant that mom could drive or dad could drive there with the kids, know that the younger ones were taken care of, and that they could be present with their youth advocate as well.
Great, thank you.
Wonderful. I want to close out this wonderful webinar with great thanks to Mallory Sir and Maya Stitt and Becky Burns and Sharon Fleshpresser. It's been a great session, and I think we should all, as Mel said at the early part of this, keep in mind that all of our work is really trying to get at all the rings of Eileen Forlenza's circle. You can't succeed in transition if you're not individually affecting people one-on-one and working at the community level and at the outer ring. So I thank all of you for your participation, and please check our website and where all the resources are on the webinar series. Thanks again.